Hello, my name is Jeff Petersen. I'm a physical therapist with Petersen Physical Therapy, and we're going to talk today about some specifics of how to protect the joints, particularly in the lower quadrant. And when I say lower quadrant, we usually divide the body into upper, lower, right, left. So the lower quadrants include the low back, the sacroiliac joint, the hips, knees, and ankles. So we'll talk about some specific tips on how you might protect a normal, somewhat healthy joint as we get older. So if this is helpful, please subscribe, like, and follow us and share it with your friends. We always appreciate your feedback. So let's talk about the lower quadrant. When we talk about the lower quadrant, we start with the low back. So the low back has joints at each, there are 2 joints on each side of each segment. In the earlier episode, I talked about some of the forces that are applied to the low back, or to the joints, which include traction forces or compressive forces. One of the most common causes of low back pain are the compressive forces and the shearing forces that occur just from day-to-day activities. So the most important thing one can do to protect one's low back is, well, it's true of all joints. The most important thing we can do to protect any joint in our body is to stay well hydrated, eat well, so good nutrition, and make sure we're staying strong and flexible. So when it comes to the low back, it becomes a little more complicated because it becomes the foundation of what we do. So we've heard of core muscles. So there are several core muscles. There are small muscles that attach from these projections here. They go up several layers. Then you've got muscles that attach on these front that come down into the hip. And then you have the abdominal muscles that sometimes are included in the core. But the idea is we want to keep our core, our center of our body strong, and we want to keep our hips flexible, particularly the hamstrings, the hip flexors. Because when you have tight hamstrings, it's going to pull your trunk into some flexion. If you have tight hip flexors, it might pull your back into extension. So that's really important for all of our joints, is to keep them active, flexible, and strong. In the low back, one of the more important things we can do to protect these joints is to really watch our posture on a day-to-day basis. So what we do every day. If you're sitting at a computer all day long, what tends to happen is you sit and you get into that flex position, you stretch, so you're creating tension on those joint capsules. You're inhibiting these muscles so they're not moving the joints properly. You can create some instability, and then as a response to that, what you often see people doing is arching their back the other way to try to put those joints in a closed packed position to stabilize them. So whether you're in a fully flexed position or you tend to arch your back, we see this with aged gymnasts and dancers because of the instability that they have. They tend to work into an arched position. So either one of those extremes are not helpful. So by keeping your hamstrings flexible, your glutes and your hips strong, and really watching your posture. So sitting is important, and we have several episodes on the ergonomics of sitting at a computer. I would encourage you guys to watch those, because that's one of the most important things you can do to protect your back joints. The other thing that helps protect your back joints is making sure you stay strong in the glutes, flexible in the hamstrings, strong in your core, particularly your abdominal muscles. You know, a couple of years ago, I looked in the mirror. I was that guy with a big belly and no butt, and I was having hip and back pain. So I was sticking out here a little greater than I wanted to, and I had no glute strength. So really strengthening your glutes are important to protect your low back. The other thing that's helpful is we start to go, you know, this whole quadrant acts together. So not only is it important to protect your low back, but you also want to look at your sacroiliac joint. The average man my age, this joint is probably fused. But for women who have had babies, for women who are hypermobile, for women who have been gymnasts, dancers, that, you know, their joints get a little loosey-goosey, this can continue to move and create irritation. There's not much movement at this joint, and it's a plain joint, and it's an accessory joint, so there aren't really muscles that move it. But sitting with your legs crossed can cause this to open up. Activities of daily and nightly living. When you flex your hips all the way and open this joint up, that can create a problem. Hiking, if you're taking too large of a step, if you're stepping up. I've often seen it when you look at a woman on the treadmill and she's really moving her hips. Sometimes that movement comes to the sacroiliac joint, and that can become a problem. And it's hard to determine, is that from your back or from your hip? And sometimes people can't decide where it comes from because they can't really feel it. I did a whole discussion on pain. I would encourage you to look at that one too. So the SI joint is important. The most key things there are, don't sit with your legs crossed. Be careful what kind of step you're taking if you have any irritation, how long they are. And if you're hiking, if you're walking upstairs, making sure you're not getting into too much hip flexion. If you are of childbearing age and you're pregnant, your hormones change, this joint is going to become hypermobile because it's preparing your body for the delivery of the baby. So you need to be careful with that. So pre-pregnancy fitness levels are really important. Particularly, again, flexible hips in the front, strong hips in the front, strong hips in the back, particularly the glutes. About the best thing you could do for that. And then as we move down into the hip, I'm of the age where my wife is starting to have some hip pain. She's been really active and she's a little hypermobile. You start to see the pain in the hip. Now the thing about the hips, people say, "Oh, I'll just get a hip replacement." Until it's bone on bone, the pain that's coming from your hip is typically the soft tissue. So articular cartilage is not really innervated with the type of nerves that send pain signals. But what happens is you get a wear and tear of a portion of this ball or in the socket, and the hip doesn't move properly. As it doesn't move properly, the front of the hip capsule gets tight, the back of the hip gets weak, you start to have weak glutes, and you start walking differently, and the typical gait pattern we see is the short step, toe in, kind of leaning over. The way you protect this joint, look at the activities. Again, you don't want to cross your legs when you're sitting because that's going to reinforce that capsular pattern. You want to make sure that if you have any pain with walking, we work on increasing the flexibility of the hip flexors, increasing the strength of the glutes, and work on increasing the flexibility of the hamstrings. But typically in the average hypermobile female, strengthening of the core and the hips is going to be what protects the hip and allows you to maintain the life of that hip so you don't have to have a joint replacement. In next sessions, we'll go over knee and ankle. I appreciate you spending some time with me, and if this is helpful, again, subscribe, share, and follow us on Facebook.